Today she's going to speak about her recent publication, the CCHF Medicare How-To Guide, a one-of-a-kind resource designed to arm Americans with a wealth of information to protect them from common Medicare traps. Please welcome Twila Brase.
Well, thank you, everyone, for being here. Thank you for Jane and Jeremy invited me, and I don't even know where Jane is, but I'm going to see you soon. I just flew in from Miami, and I'm glad to see all of you here, and I'm glad to be in your presence because you are the fighters for freedom that we all need. And I would love to see you get even bigger and bigger and bigger. So our organization will try to do everything possible to make sure that we have doctors in freedom long into our future. Let me just make sure I know how to do this here. Oh, good. Okay. So our organization, CCHF, is on a mission, and that mission is to protect patient and doctor freedom. We were established in 1998. We are pro-patient, pro-privacy, and pro-free market. And pro-privacy because he who holds the data makes the rules. It's the foundation of freedom. So what we like to tell people that we provide is high-level policy engagement and practical tools, on-the-ground tools for regular people to protect themselves in the exam room. And I want to just make it clear that we are not trying as an organization to rearrange the chairs on the deck of the Titanic, but we are actually trying to build a new framework for health freedom in this country. So build a new ship. All right, so we did create this guide, the Medicare How-To Guide, and in that guide are 10 Medicare traps. And that's really what I'm here to talk with you about today. And so, trap number 1, the Medicare program itself is a trap. So there's no escape. When you turn 65, you really have no other options but Medicare. Now, there's a lot of people who think that's really great, but it's not really great if they really understood what's happening in the background or they understood how little money there is left. I think the other really interesting thing about this is how suddenly you are a senior when you're 65. And I believe that idea that you're a senior when you're 65 is tied to Medicare. If we didn't have Medicare, who would be a senior and where would the line be drawn? I think it has done something even within the psyche of the country because there are so many people who are 80 that I know who are out there playing 18 rounds of golf or doing, running businesses. But when you're 65, suddenly you're a senior. You're dependent on the federal budget, and if you refuse to go into Medicare Part A, you get no Social Security, thanks to the Clintons. But as I said, it's running out of money. Here's a picture of from the trustees' report, and so the red line is the Medicare line. The green line is disability, so disability is in fine shape. And the blue line, which is the highest one and that goes straight down, that one is Social Security. But the red line is hospital insurance, or Part A. Now here are the federal solutions to solve this problem, which of course are not solutions whatsoever, but they're trying to corral citizens into the free version of Medicare, which is Medicare Advantage. Schweikert from Arizona, Congressman Schweikert, just came out with a bill intending to lock seniors, brand new seniors going into Medicare, locking them into Medicare Advantage for 3 years. And so he wants everybody in Medicare Advantage, and then you can get out, but by that time he figures you won't get out. And then there's the CMS is adding prior authorization to original Medicare. So original Medicare has not had prior authorization except for a very few things. Basically, the doctor orders it and you can get it. But for starting on January 1st in 6 states, and about, I don't know, I didn't really count them, but it's probably about 25 different procedures or diagnoses that you will have to have, procedures that you will have to have prior authorization for. So this is just the beginning, and I do believe that this is because of Dr. Oz. So Dr. Oz, with George Helverson, who was head of Health Partners and head of Premier Health, they did an article in 2020, and it was called Medicare Advantage for All is the solution to healthcare in this country. And I think because Dr. Oz is now head of CMS is why we have prior authorization suddenly in Medicare, in original Medicare. And I think that's just the camel's nose under the tent. The idea would be to just spread it through all procedures that you'd have to get permission. And of course, they're paying doctors less and health plans more, and I've got more information on that in a little bit. They're using non-physicians, and they're moving to AI. And these are all the ways that they think that they're going to solve the Medicare problem. Of course, none of this is going to work. Trap number 2, there's no other coverage options. Health plans offer no coverage at age 65. You're limited to Medicare. And then the ACA eliminated true health insurance, which is major medical policies. You try as a senior to get one of those, and that's virtually impossible unless you have held onto it and somehow you've been grandfathered in. Employers are allowed to shift older employees to Medicare, even though the employees are working for the company. Cash is not accepted for care that Medicare denies if it's a participating physician. And then opted-out doctors may not be available for what you need. So you need X, but the doctors all in your area don't do whatever that thing is. Okay, trap number 3, financial penalties for delayed enrollment. So here are the penalties. Medicare Part A, it's 10% times twice the number of years that you have stayed out when they thought you should be in. So you have not enrolled when they say that you should. Medicare Part B, it's 10% per 12 months, and it's a lifetime penalty, and it's cumulative. So Medicare Part D is 1% increase or 1% fine per month, and that also is cumulative and lifetime. Trap number 4, so this is part of, the number 1 trap, which is Medicare itself is a trap, but then here are the traps to make sure that you end up in there and you'll be trapped with higher prices if you resist. Trap number 4, Medigap rule restrictions. Medigap is only available in original Medicare, and this coverage is not allowed in Medicare Advantage, but it really helps people in original Medicare to pay for costs that wouldn't otherwise be covered. You have only 180 days to choose Medigap without underwriting. And then there's this Schweikert bill, to lock people out of original Medicare and out of Medigap. Trap number 5, there are hidden Medigap traps. So Medigap Plan N is a pretty good Medigap plan, but you really have only 6 months after you enroll in Medicare Part B. And if you do not choose it then and you make a decision later, it is the only plan that does not allow you to switch as easily into it. If you lose your Medigap plan, whatever it is, decides to go out of business, and then Medicare allows you to pick any other plan, but not Plan N. So Plan N is a very limited time that you can get in there. You can try, but if they do medical underwriting, they'll say no. They could say no. Then you're priced out. A lot of people are being priced out of their Medigap plans because the premiums are rising. And so they try to find other Medigap insurers who are allowed to say no. And if you have had situations in your life that have given you pre-existing conditions, they're likely to say no. And then there's the problem with the death spiral. So you found a really good plan. That plan decides that it's going to cut off all enrollment, but it's not going to go away. It's just going to let it, by attrition, just gradually lose people. But as attrition happens, the prices go up and up and up and up. But you cannot automatically get into any other kind of plan until it shuts itself off. And so you're really stuck with very high premiums or trying to find some other plan that will let you in after medical underwriting. Trap number 6, Medicare Advantage organizations. I'm just going to say a little bit more on this one than on other ones. So the dangers of Medicare Advantage, it can legally ration healthcare. That's what health plans are allowed to do. It is rationing healthcare, and there have been federal reports to say so. Of course, as you know, that uses networks, prior authorization, step therapy, and more. Medicare Advantage is ripping off taxpayers. This year, the expectation is that the federal government will pay in totality $84 billion more to these health plans than they are paying for the other half of the people who are in original Medicare. And what I like to tell people is that zero premiums, which I think is a really great deal, zero premiums could become zero care. And in the end, Medicare Advantage, which is so cheap now, when you actually need it, could be much more expensive in out-of-pocket costs. Now, this quote here is from Dr. Kenneth Williams, CEO of Alliance Healthcare, in 2023. They don't want to reimburse for anything. Deny, deny, deny. They are taking over Medicare, and they are taking advantage of elderly patients. Now you realize all the money that they're getting is from you, the taxpayers. So this is, very lucrative for them to simply deny, 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 and keep as much money as possible. Here are just some statistics from Medicare Advantage. I told you already about the 84 million. You all know probably about upcoding and making people look more expensive than they are. But the number that comes out is that with this money that the health plans are getting, it's 22% more or higher payment for every enrollee in Medicare Advantage than for any enrollee in original Medicare. So it's a very lucrative business for them. 54% of all Medicare patients are enrolled in Medicare Advantage. 70% of them have zero premium. And a lot of people, we have this name Medicare Advantage, but really when you look at it, we consider it Medicare Disadvantage. Now here are the denial reports from the HHS Office of Inspector General. The first one was in 2015, and then the really telling one was in 2018, where it said that 75% of the denials, if appealed, would be overturned by the health plans themselves, 75% of them. But it found that only 1% of denials are ever appealed. So it is very lucrative for them to deny, 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 and see who has the wherewithal, who is, not sick enough that they can actually go through the process, who can speak English, and who doesn't feel afraid. But the HHS said that this is a burden for elderly, and of course these elderly could be dying or sick or not speak English or whatever, right? But anyway, that's their statistic. And then here is the arduous appeals process that if you're a patient, you're forced to go through in hopes that your Medicare Advantage plan will pay. And now, despite all of this, again, Dr. Oz, now Director of Centers for Medicare Services, and we as an organization, CCHF, we contacted Trump and we said, please, no Dr. Oz. But we've heard some ideas of how he may have gotten the position. But anyway, here is the article that he wrote with, now this is Steve Forbes, sort of like introducing it, but this is from George Helverson and Dr. Oz. And here's a quote at the bottom. We could achieve these goals by buying healthcare coverage for every American who is not on Medicaid through the Medicare Advantage program. We could fund this universal coverage entirely with a full financial security by using an affordable 20% payroll tax. Okay, and then unfortunately we have Heritage Foundation, who in the Project 2025 said that they thought that Medicare Advantage should be the default option. So everybody should just be automatically enrolled in Medicare Advantage. And so we sent a letter to the president of Heritage in January, and we never got a response. And I think it was in March, maybe I stopped by there when I was in DC, and I couldn't get up, and nobody responded to the note that I sent. Okay, trap number 7, workers pay higher premiums. So here's the scenario. You're 65 years old, your company has fewer than 20 employees, you're still working full-time, you're forced onto Medicare because you're 65 and because it's less than 20 employees. But unlike retirees, you still pay the payroll tax, and then Medicare charges you more for working. It's called the IRMA, the income-related monthly adjusted amount, and it is significant, and it is attached to your B and your D. Trap number 8, you're on the hook for stays at the hospitals and skilled nursing facilities. So you all probably know this, but it was certainly a learning for me in writing part of this guide. The hospitals are paid by benefit period. Medicare Part A pays for 90 days per benefit period. There are increased costs to the patient after 90 days. There's absolutely no payment whatsoever for the care after 150 days. Medigap policies will pay for the care after 150 days. They will pay the extra after 60 days. And so when people say, well, I'll just go into Part A and I'll go into Part B and I'm not going to do any Medigap. Now that I, found this out, I'm like, you might want to think about that, because if you end up hospitalized for a long time, it'll all be on you. The other thing that's interesting about this is just outpatient versus inpatient, and one of the recommendations in this guide is that every day you're a patient, you ask, am I outpatient or inpatient? Because you could be caught. All right, trap number 9, government recipients are under surveillance. You're government dependent, you no longer have a right to privacy, you don't have a right to care. The decisions of the doctor are tracked, and then everybody in that doctor's practice, all of their medical records are susceptible to being called into Medicare, because Medicare has claimed a right to look at every record in the doctor's office who takes one Medicare patient to find out about the quality of the doctor's practice over the entire practice. And then trap number 10, access to drugs are limited by Part D options. So the drug coverage is not individualized, as you probably know, in Part D. The formularies are not comprehensive. Available medications are limited, just like in Canada. They can change yearly or mid-year, and so patients have to be aware of, did something change here, or am I still eligible to get that drug? And then the appeals process is intimidating. So we have solutions for Medicare, none of which that I believe Congress is totally interested in, but really they should be very interested in it. One of them is the Retirement Freedom Act. Now, the Retirement Freedom Act allows seniors to opt out of Medicare without losing their Social Security benefits. So when the Clintons tied these together in 1993, they did it by executive instruction. Those are the words I have heard. So no law, no rule, no period of public notice and comment, nothing of that. They just did it. It's been followed ever since 1993. And if you do not go into Medicare Part A, you will not only lose your Social Security benefits, but if you then decide later that your life is being rationed away and you really want to have something different and you want to get out, you will be required to pay back every dime that you have ever received in Social Security benefits and Medicare benefits. And this is what the Clintons wrote in. And again, no law, no rule, no nothing. So one of the things that, Palmer in Alabama is the House author of this bill, Gary Palmer. And Cruz's office just let us know last week that they will be reintroducing this bill on Tuesday, September 16th. Yes, and so it has taken us quite some time, because for a while he didn't have any health policy staffer. So there's nobody for us to talk to, because apparently the Trump administration has been poaching staff of members of Congress. But anyway, after that happens, we will try to get a lot of different co-authors and hopefully would be able to get this into committee or something to move forward while Trump is still in office and maybe actually become law. Sketchy possibilities of that, but we're certainly going to try. But if we are successful, what are seniors going to buy on the outside when the Affordable Care Act says you cannot have catastrophic coverage after the age of 29? So we have this other bill that we're calling MAHIRA, Make Health Insurance Real Again. And it would say that everybody at every age could have access to an indemnity policy, catastrophic indemnity policy, and that's real insurance. So we should all have access to real insurance that doesn't even need a health plan, a policy that will actually pay you. And then the third thing that we're doing is we're just looking at this idea of age discrimination. I mean, why? We're in a free country, right? Age 65, suddenly your money is not good to buy insurance. You can't do it. And so it seems to me that there is a problem here with age discrimination. Would love to find somebody to go after that. And then, of course, we did our Medicare how-to guide to just help people make the best decision that they can. Here's what the guide looks like. There are just a few one-pagers out on our table, which is straight out that door over there. And it has a QR code on it. It's free for everybody. I do believe it has the best directory of terms or dictionary of terms and definitions that you'll find anywhere. And a former very high Medicare executive in Trump #1 administration called it a real service and said it's got information in that nobody else will find elsewhere. Here's just some of the things we have in here. I just put 2. 12 questions to ask your Medicare agents, including, are you independent or are you going to try to get me into Medicare Advantage? And then my Medicare checklist to just help people. But we got lots of stuff in there beyond this. And there's a document, a page that's called Key Points, and these are 6 of the 12. Do your research early and use an independent agent. Find an independent agent. Count current and future costs. Understand original Medicare is not full coverage. Know the difference between original and Advantage. Review the realities of Medicare Advantage, and don't miss payment deadlines because you could be a lifetime of paying extra. Now, I've been given permission to do a quick topic switch because our organization is leading the charge against Real ID in this country. And you might even wonder, thank you. And you might even wonder why a health freedom organization would do that. And I will explain that in a minute. But I only got a few slides, and Jeremy said it was a go, so here you go. Because people have been deceived in this country about Real ID. And so I have a podium here, and I'm going to use it. All right, this is our refuserealid.org is our special page to help people get out of Real ID and stop Real ID, and here's why you should be concerned. Real ID is a federal ID for a national surveillance system. It is not a state driver's license with a star on it. The federal government has hijacked all the state DMVs, forcing them essentially, commandeering them to create something that looks like a state driver's license, but it's a federal ID for federal control, and it's under federal control. It'll become, I believe, an internal passport for Americans for all of life, from transactions to access to movement, and it's because of what the law says. The law says it's for access to federal facilities, nuclear facilities, commercial flight, and any other official purposes as the Secretary shall determine. And so that opens up, buying a gun, renting a vehicle, opening a bank account, anything you can think of, including access to medical care. And I think it will lead to no card, no care. And as a matter of fact, I believe if they really wanted to force everybody to submit, using that language of any other purposes that the Secretary shall determine, they would choose health care because, after all, 47% of health care is paid for by the government. It would be the easiest thing for them to do. And just to let you know where this is going, here's from the Department of Homeland Security in 2007. We're starting the process of biometrifying a good proportion of the world population. In other words, facial recognition, palm scans, fingerprints, all the biometrics. And that came out of our Department of Homeland Security in 2007, 2 years after Real ID passed. But I believe it will also become a vaccine passport, medical record, linking up to all of your medical records, a unique patient identifier, and linking up to the global digital ID. And so why should you oppose it? Because it's unconstitutional, commandeering by the federal government of the states. There's the future expansion into all of these other things. It's going to be digitized. The DMVs have testified to Congress in 2003. They're going to digitize it, put it on your phone, and have remote access to it. And then they start with the biometric of the face, because facial recognition software is where they're going. And then I believe it will also lead to social credit system, establishing the foundation to set up a social credit system in this country, just like you saw working in China. We have a three-pronged approach of opposition: engaging the public to get rid of their real IDs, turn them in, and to refuse the real ID. State legislators in 12 states are moving to stop the real ID with our help. We've contacted all the state AGs, and we've had conversations with a bunch of them. That's where I came from in Miami. They asked us to do a legal analysis that has been completed and sent to them exactly a week ago. This is something that we did, just a few billboards. Here is this address if you want more information. Here's some of the documents that you can find, including lose the real ID, step-by-step, how to get rid of it, a practical guide to getting rid of it. And then here are just 3 resources I want to let you know before I get off the stage. One is our CCHF discharge instructions. This is if you were, just not physicians. This is our discharging the people in our audiences into the world of healthcare to protect themselves from coercion in the exam room. And this is our wedge of health freedom for direct pay practices. We have 510 in. We would love lots and lots and lots more. This is one of the original maps for it. It's all over the nation. And then this is the book, Big Brother in the Exam Room, The Dangerous Truth. And it is in the fourth printing, actually, and has gotten 8 awards. So here's how you can contact me, but of course I'll be out there. And we are solely donor supported, so if any of you wish to support us, that would be great. And then, as I know you all know, there is much at stake in the fight for health freedom. Thank you.